Welcome to FASEB DataWorks videos. In this series of short videos, we guide life sciences researchers through key topics in data management. Today, we're focusing on how to budget for data management and sharing in your grant application to the National Institutes of Health. When the NIH rolled out its new data management and sharing policy in January 2023, one of the changes was to include financial support for data management and sharing in their grants. This video will cover what you need to know about planning the budget for your data management and sharing plan for an NIH grant. Before we get started, you should know that this video is a general overview aimed at those with some background knowledge of grant writing and data management processes. However, policies will vary by institution and NIH office, so check with your institution's Office of Research or Office of Sponsored Programs and your NIH program officer if you are ever in any doubt. First, let's go over allowable and unallowable costs. Generally speaking, NIH allows you to budget for any costs of data management and sharing that are unique to your project. For example, you could budget for buying cloud storage for your project. However, if the cloud storage you buy would be used for many different projects, that is considered an infrastructure cost and is not allowed in the grant. Another example would be buying a new software package to process the data generated by your project. If the software is only being used by this project, that cost is allowable. But if the software will be reused on other projects, it's considered an infrastructure cost and therefore not allowable. Other allowable costs include expenses associated with preparing data for sharing. For example, the cost of curating data, reformatting data to make it more easily reusable, de-identifying data, developing supporting documentation and metadata, or paying fees required by your chosen data repository. Costs that are not allowed include those associated with the routine conduct of research, facilities, and administrative costs, or costs that are charged as both direct and indirect costs. For example, suppose your campus facilities include working storage up to 5 terabytes, but you need 10 terabytes of working storage for your project. In this case, you can only include the cost of 5 terabytes of storage in your budget because the other 5 are covered by your institution. You also must clearly make the case in your budget justification for why you need more than 5 terabytes of storage. Here is a summary of the allowable budget items: curating data, developing supporting documentation, formatting data according to accepted community standards or for transmission to and storage at a selected repository for long-term preservation and access, de-identifying data, preparing metadata to foster discoverability, interpretation, and reuse, local data management considerations such as unique and specialized information infrastructure necessary to provide local management and preservation, and preserving and sharing data through established repositories such as data deposit fees. And here is the summary of unallowable budget items: infrastructure costs that are included in institutional overhead, for example, facilities and administrative costs, costs associated with the routine conduct of research, including costs associated with collecting or gaining access to research data, costs that are double charged or inconsistently charged as both direct and indirect costs. Principal investigators tend to underestimate how much data management will cost. The management cost for a grant will almost never be zero. If nothing else, staff members will have to spend time executing your data management plan. Also, NIH staff have indicated that they expect to see money budgeted for data management and sharing. If you're unsure what to include in your data management and sharing budget, we suggest starting with staff time. You should also check if your chosen repository will require any fees when you deposit your data, especially if you are dealing with very large data sets. Finally, if you are working with human data, consider whether you will need to use de-identification specialists. De-identification can be very complicated and expensive. If you need help, get a quote from an outside vendor or your in-house team before submitting your grant. A reasonable cost estimate for professional de-identification of a clinical trial is around $10,000. Now that you have considered the possible costs you will include in your data management and sharing budget, let's talk about the application process. In the budget, data management and sharing costs will be included with other costs in the appropriate categories, for example, with personnel, equipment, or supplies. However, you need to include a separate short justification for your data management and sharing budget in both the NIH modular and R&R budget. You must include this justification even if your data management and sharing cost is zero. If the cost is zero, explain in the budget justification why you are not budgeting anything for data management and sharing. As a reminder, the NIH staff have indicated they expect to see money budgeted for data management and sharing. We hope this video was helpful, and we thank you for listening. If you have comments or questions for us, please send them to dataworks@faseb.org. If you want to learn more, please scan the QR code to visit our help desk. Happy budgeting from the DataWorks video team.